Now that we talked about the different interventions for it, we have to talk about the effectiveness of it. So based on the research, based on the literature, there's not a whole lot out there, specifically regarding how well manual therapy is with conservative management for thoracic outlet syndrome. But there are a couple promising studies. An older study back in 1995, 25 of 42 patients with neurogenic TOS had symptom relief after 6 months of PT. So that's a majority of patients to show that a bout of PT was helpful. The people that didn't do as well, that didn't have good outcomes, there were some comorbidities associated with them, such as obesity, double crush pathology. Some of them were workers' comp patients, so there could have been some biopsychosocial concerns since they were out of work. That all might have led to the improvements not being as great. Another study done in 2010, Watson was more of a expert opinion piece that he wrote. So this was not a true study carried out, but an expert opinion piece where he saw that working specifically on scapula control, scapula movement, scapula position, and working on neuromuscular retraining of it, working on mobilizations to that area, showed a positive effect, showed that those can improve patients' function with TOS. Vanti in 2007 did a literature review of all of this, of conservative management of TOS. And their findings were that firm conclusions cannot be drawn. However, they did show that in 13 studies, in a short-term follow-up of 1 month, 76 to 100% of patients had good or very good results with conservative management. Go out over a long-term follow-up after a year, 59 to 88% had good or very good results from conservative management. So you can, even though firm conclusions cannot be drawn, we can take this away and say that, hey, majority of the patients, 3/4 plus of the patients had benefited from conservative management in the short term, and still maybe less, but still a majority of patients benefited from conservative management after a year. The limitation with this review, there were no randomized control trials, no systematic reviews, and no meta-analyses, though. A couple other literature reviews, one by Lee in 2021, basically concluded that manipulation therapy of the thoracic outlet was unclear if to be beneficial or not. Some people had good positive effects from it, but other people didn't have positive effects where they actually had worsening of symptoms due to symptom provocation. And then Collins concluded in his literature review, also in 2021, that it can be beneficial to do conservative management, but standardized treatment approach has not been established. So there are no standardized protocols, no definite procedural treatment programs that we should be doing. Instead, it's patient-to-patient based. It's an individualized treatment approach that we have to take on. So in addition to our PT interventions, we want to integrate other parts of their health. So we want to look at their lymphatic and their venous return. We want to look at their neural sensitivity, not just in the thoracic outlet, but down the arm as well. If they have more of a nociplastic pain phenotype where central nervous system are undergoing changes, we may have to intervene here or utilize other techniques and strategies to help with that. This might be some imagery techniques, some cognitive behavioral training, and that goes along with the biopsychosocial concerns as well. If they have other comorbidities like asthma, COPD, the ones we mentioned earlier, this is going to maybe challenge us more as PTs, and we might have to kind of teach them some other breathing techniques in addition to our manual interventions. But I think what's important is that we're not just educating the patient about this, but we're empowering the patient. The patients have to understand that this is a responsibility that they have to take on, that this isn't going to improve with just a few PT sessions, and it's not just something that is going to be a fix. It's a lifestyle change for some people. It's an activity modification for some people, and they have to understand that and take that responsibility so that they are feeling better and can live a better life. So, kind of to conclude, yes, we know that there are no specific procedures that are going to work for all TOS patients. We discussed all different joints, all different muscles, all different areas of the body to look at for people with TOS, and we have to really take an individualized treatment approach. We have to assess these joints, mobilize these joints, reassess after, and if they find benefit from it, if we do see symptom reduction, then that's great, and that's something that we can do as PTs to help with these patients. We want to try our best to reduce the entrapment sites and reduce any factors that may lead to entrapment. So that goes back to empowering the patient about their lifestyle changes. We definitely want to reduce the need for surgical interventions. There's a lot of associated risks with surgery, and if we can have people hold off on surgery, then that's the better way to go. And again, with going along with patient empowerment, we want to promote a long-lasting effect. Changes to their posture, changes to their the way they position themselves are going to all be helpful so that they can have less symptoms and improve their quality of life. Here are all my references, and that is it. Thank you.